Hi everybody, thank you for joining me. I'm going to show you how to do venipuncture, which is placing a peripheral IV. I wanted to show you real quick to compare with the different types of, or the different gauges of needles that we can use. So I'll show you a 24 here first. This is a 24 gauge. If we pull it out by the handle here, you'll see that this IV is pretty thin, pretty short and kind of thread-like. So that's going to be one of our smaller ones. That's a 24. If we go up just a little bit, this is a 22. And you can see that it's a little bit thicker, a little bit longer, bigger IV. So that's a 22. And then finally, if we go all the way up to an 18, this guy is very thick, long, a real hardy needle. So we're going to use these different needles for different reasons. A PEDS patient or a geriatric patient that has really small vasculature, or somebody that has difficult to find sites, you might use a 24 gauge. Whereas if you've got a nice, strong, hardy 16-year-old with nice, big, juicy veins, you're going to do maybe an 18 gauge. Or the bigger gauges sometimes are used for infusing blood. There's different pieces to these equipment. You saw that I pulled off two ends of the cap. And then you've got a handle down here, and then this green part is your catheter. So you've got a firm, sharp needle that you're going to pierce the vein with, and over that needle is this flimsy plastic cannula. This is what stays inside of your patient. You pull the needle out, and this guy is left behind. So those are the two pieces there. I do want to show you a little bit of safety for the lab. We want to make sure that we are not having any needle sticks in the lab. So we are never going to have you recap like this. You're pointing right at yourself, you're going to end up missing, and you're going to poke your own hand. So what we do is we lay the cap down, get this extra hand out of the way. We're only using this hand. We're going to scoop our cap up. That way if we poke anything, we're poking the cap, not ourselves. And then give it a little click. And then you can put the other end on. There you go. We'll do it one more time. Keep my extra hand out of the way. Going to scoop, give it a little pop, and then put the end on. You're of course not going to do this in the real world. We never reuse our needles. We never recap dirty needles in the lab because these are expensive and they create a lot of waste. We will reuse them until they wear out. So you will place your IV. This is going to get left in your mannequin, and you're going to have your needle. When you're done, you take it out of your mannequin. You're going to scoop your catheter back on and scoop your lid back on. All right, so now I'm going to bring down our mannequin here. And we're going to place a peripheral IV. The first thing that we want to do is we want to apply our tourniquet to cut off circulation and let those veins fill up and get nice and juicy. So we're going to cross over, and then we're going to bring this one back and tuck. You want this pretty tight so that way these veins are filling up. You don't want these guys flopping down over the site because they'll contaminate. So make sure that your bunny ears are pointed up. After you get the tourniquet on, you're going to start looking and palpating. We want to make sure that this does not have any scar tissue, surgical wounds, tattoos. We want to have healthy surrounding tissue, and then we want to have healthy veins. So if our patient has a history of a mastectomy on this side, or if they've had a stroke and this is their paralyzed side, we are not going to put a vein or a IV on this side. The other thing is that we want nice spongy veins. This has just a rubbery, spongy type feeling, so that's a good one. We don't want ones that are firm or bumpy, like that there is probably a valve or a vesicosity. And we don't want ones that are real, if you see these down here, that are real curvy. We want a nice, long, straight landing pad. That way I have enough room to get my needle in. Down here, I just don't have enough room to get a needle in. So we've looked, we've palpated, we found ourselves a nice, good vein. The other suggestion that I always say is make one finger your feeling finger. The more that you use this finger, the more sensitive it's going to be. You're training it. If you always switch around, you're not going to hone in on one. So pick your finger, and that'll be your feeling finger, not your thumb, but one of your fingers. All right, so I palpated. I found myself a nice vein. I'm going to take this tourniquet off and let him get some breathing air. He needs to have the circulation back again. So tourniquet's off. I figured out this is my vein right here. so I'm going to clean it. You can use alcohol or chloroprep. Sorry about that. Alcohol or chloroprep, it just depends on your policy's guidelines. This is chloroprep. It comes in a glass vial. You're just going to give it a firm crack, and then this sponge will start to get saturated, and then that's what you're going to clean with. Firm strokes back and forth. Our patients have been rolling and pudding. They've been sweating, exposed to all sorts of stuff, and we don't want that in their vasculature. So nice firm clean, and then we're going to let it dry. We need that to dry for 30 seconds. So while we're waiting, we're going to get all of our supplies ready. So I'm going to bring over and open up my saline flush. Keep the tip dry or sterile. I'm going to prime out the air and put the cap back on without contaminating. The next thing I'm going to do is open up my J-loop. Now this J-loop comes sterile in the package, and I know that I'm hovering over my patient, I'm touching my patient. That's just so I can get to the camera. In the real life, you are not going to touch the site, you're not going to cross over it and contaminate it. So anyways, this J-loop comes in the package sterile. As long as you don't touch this end, then you won't have to clean it. So pick up right here, away from that end, and make sure that you keep track of this and you don't drag it on anything. So grab this guy right here, and you're going to hook him up to your flush. All right, once I've got them hooked together, I'm going to give it a little bit of a push so that it's primed. So my line is now primed. I'm going to stick this guy right back in this package so he's not sitting on anything dirty and I don't have to worry about him. He's off to the side and he's safe and sterile. The other thing I forgot to mention, these caps are pretty tight on here, so you're going to want to loosen it, because when you've got your IV in place and you're trying to struggle to open this, it's going to be a hassle. So kind of loosen it up and just gently set it back on there. Put it in your package and set it off to the side. All right, so I have my J-loop primed with my flush. I'm going to get out my Opsite or Tegaderm. The thing that I like to do with these is kind of peel this back and leave it like that. So that way when my hands are full with the IV, I don't have to worry about messing with getting this open. I can just grab it like this and stick it on. So I've got my tape there. And the last thing that I want to do is to make sure to put on my gloves to protect myself. My tip for the gloves is the tighter the better. If you have loose gloves and they're hanging off of you like this, when you're touching stuff, that's gonna flop over and it's gonna contaminate. So I always say super, super tight gloves. That way you don't have anything contaminating. And I've got a couple pieces of tape here that I didn't show you. A couple pieces of tape ready to go so that I don't have to get those ready when I've got my IV in place. All right, and the last thing that I'm going to do is get my IV ready. I'm going to open this up, take it out by the handle. This yellow part, the hub, sometimes is kind of like vacuumed or stuck on there. So I'm going to give it a tiny little swirl to break that seal. That way when I'm ready to push this off, it's not stuck and I'm not panicking. So I've got that ready. I'm going to scoop it and leave it right there ready to go. Patient's clean. I did not touch him. I did not bump this. If I noticed that I did, I'd go back and clean it again. So I'm going to put my tourniquet back on, crossing over and tucking. You are going to want to touch because you just want to be sure. Don't touch. You're not allowed. It's clean, okay? You've figured out where that vein is already. You just got to trust yourself. I've got my catheter here. I'm going to put the bevel up. I'm sure you can't see that hole, but I've got the hole up. And then I am going to apply reverse traction, which means I'm going to grab his skin and kind of pull up towards his armpit. What this is doing is it's stabilizing the skin, it's stabilizing the vein, so it's not wiggling around when I'm trying to poke him. So you're going to grab and you're going to pull upwards. The next thing that you're going to do is you're going to barely pierce his skin, and you're going to immediately, pretty much immediately, you're going to feel a pop. And you can see that I've already hit his vein because I've got blood flow. I'm just barely in there. I haven't really done much. That's all the further that you need to go. That's where you're going to feel the pop. You're immediately going to stop, because if I keep advancing at this angle, I'm going to pierce all the way through his vein, and then I've just like broken his vein. It's useless. So I felt the pop. I immediately drop my angle down. See how I'm perpendicular with him? I'm no longer at a sharp angle. I'm dropped down. This is when I'm going to advance my catheter a little bit further. I am not putting that whole needle in his arm. That'll hurt. It's not nice. So just advance it a little bit further. The next thing that you need to do is you need to get this yellow catheter into him, not the needle. So this left hand here, I'm resting on his skin. I am not going to move my left hand. It's stabilized, it's anchored, it's going to stay put. This hand is going to grab way up here and slide this towards him. See how that goes flush with his skin? I did not touch his insertion site. I did not touch the white catheter part, just way up here, out of the way. Now, you'll see that blood flow is starting to come out of him. To stop that, you're going to push very firmly up here. You're cutting off circulation so he's not bleeding anymore. He's plastic. It's hard to occlude him, so he's probably going to keep bleeding, and that's perfectly fine. So what you're going to do, we've got our J-loop here on standby. I've got it open. I'm going to apply that pressure, slide the needle out, and hook these two guys together. Once they are touching, then you don't have to apply your pressure anymore, so you can let go. Oh, contaminated. I would get a new one and start over. You're going to screw those two together. Now, if you'll notice, this hand is stabilized. It's not moving. I'm touching not his site, but way up here. And then this hand is way back here, so I'm not touching in this tiny little area. I call this your T fingers. You're just using these guys. You're getting all these out of the way, like you're drinking tea and crumpets. All right, so I've got those screwed together. Now we're going to pretend that he did not bleed. All right, so we hooked those together. I'm always going to keep one hand on the IV. If I let go, it starts to bend, it gets wonky and hurts him, or if I let go, he's going to move and run away from me. So this hand is going to stay here. I'm going to go over, grab my op site, and while I'm still holding on, I'm going to apply my op site. Push this down a little bit, still holding on so he's not running away from me. I'm going to pop my tourniquet, and I'm going to flush his line. So if you'll see here, I've still got my hands on here. I'm going to give it a little bit of flush, and you can see where the blood is leaving, and it's flushing very easily. I'm not having to force it. So once that I've flushed it, I'll go ahead and take this extra tape off. Make sure that it's nice and secure. And then a lot of times we will loop it up and tape it again just so this isn't flopping around. After it's taped, I usually flush it again just to make sure, yep, everything's still working great. I can unhook my flush, clamp the line, and you've got yourself a brand new IV. All right. Once I had pierced his skin, you couldn't see it behind the scenes, but I had put his needle straight to the sharp spin to protect myself. All right, we will practice this in lab. If you have questions, please make sure to pull one of us aside and we will definitely address them with you. Thanks so much.